Chair calls Chris Traylor, Chief Deputy Commissioner, Health and Human Services Commission; Kay Ghahremani, Medicaid CHIP Director, Health and Human Services Commission; Doug Wilson, Inspector General, Health and Human Services Commission; and Joseph Schmider, State EMS Director, Department of State Health Services.
Okay. Mr. Chairman, Chris Traylor again, Chief Deputy Commissioner at Health and Human Services Commission. Our Inspector General, Doug Wilson, has the bulk of this presentation, so I'd like to turn it over to him at this time.
Very good. Chair recognizes Doug Wilson.
Good morning, Mr. Chairman. Again, for the record, my name is Douglas Wilson. I serve as Inspector General for the Health and Human Services Commission. Good afternoon, members of the committee as well. I'm going to visit with you briefly about the OIG initiatives and Senate Bill 8 also. As you know, my office is responsible for prevention, detection, pursuit of fraud, waste, and abuse in our Health and Human Services programs. Senate Bill 8 passed last legislative session, and it validated OIG's authority to prevent, detect, audit, inspect, review, and investigate fraud, waste, and abuse across all Health and Human Services programs. It also authorized the OIG to employ 5 commissioned peace officers. The bill required that we be administratively attached to the Department of Public Safety, and it also required that before we take any law enforcement action, that we also get approval from the Office of the Attorney General. We signed an MOU with both of those agencies in December of 2013. We've hired 4 of the officers already. The 5th officer will start on September 1st. He's already been offered the job, but he won't join us until September 1. The bill also required us to review our processes for investigating fraud, waste, and abuse in the SNAP program, the Supplemental Nutrition and Assistance Program. We have hired a new director of the GEI Division, General Investigations Division for us. We will have that report ready on or before September 1st as required by the bill. It also strengthened our authority to exclude providers from the Texas Medicaid program who have a history of fraud, waste, or abuse. That was related to requirements of the ACA, the Affordable Care Act. We were also authorized to hire additional staff. About 127 employees came to OIG last session. Allowed us to reduce our case backlog. Also increased our nursing positions for nurses that conduct utilization reviews in hospitals and nursing facilities. Allowed us to increase our positions in third-party liability, where we deal with private insurers to ensure that Medicaid is a payer of last resort, and if there's third-party insurance identified, they're billed first, or we recover after we pay. We also deployed a data analytics system, now known as Torch. Allows us to increase detection of fraud, waste, and abuse across the Medicaid program. Utilizes data feeds from the Medicaid Management Information System. We've ingested to date about 76 months of Medicaid data, to include data from managed care organizations as well. And we've added 6 FTEs to our data analytics and fraud detection unit that is working very closely with our contractor.
Mr. Wilson, how does this unit function with the Medicaid data analysis unit, the data analytics and fraud detection unit, work with the data analysis unit established under your direction?
So Kay is, I believe, standing up her unit as we speak. We've been hiring our guys over the last year and a half. Just completed hiring all the guys probably a month or so ago. The results of our system has allowed us, I think, to share some policy gaps with Kay now. Some revisions that we thought they should consider in strengthening the program, Medicaid program, and she's accepted our recommendations. We envision that as we do our data analytics system, and Kay does her data analytics system, that the 2 directors of these divisions and their staff will meet and communicate often about things they're seeing from the data and how the data is being used, not only on the fraud, waste, and abuse side, but more so on the front end by Kay staff.
Would you like to speak to that?
Yes, so our unit is really, Kay Ghahremani, Health and Human Services Commission. The data analysis unit in the Medicaid CHIP division is focused on contract management. So the purpose of this unit will be to work with our contract management teams to use data to look at how a health plan is performing, how they might be comparing to other health plans, and give us a tool to both provide technical assistance where we need to do that, to implement corrective action plans if there seems to be some deficiency. If there's something that we are finding that might indicate that a referral is needed to OIG, then that will happen. But we are, as Doug said, kind of the front-end data analysis unit focused on contact monitoring.
Very good. Please continue, sir.
Yes, sir. We also are responsible for the lock-in program. We're now assisting MCOs as well for clients that may be overutilizing the emergency room or prescription benefits. Recently, we began conducting audits of home health providers to ensure there's adequate documentation in place for the medically dependent children's program and the comprehensive care programs as well. Go ahead.
Mr. Chairman, Chris Traylor, Health and Human Services Commission. I want to talk a little bit about changes we've made to the medical transportation program or will occur on September 1st of this year also. As you recall, back in 2012, we went to a full risk broker model for medical transportation services in the Dallas-Fort Worth and the Houston-Beaumont areas. And Senate Bill 8 required us to look at a similar model statewide to improve the efficiency in our transportation model across the state. We conducted a procurement in 11 regions across the state outside of those two full risk broker models that are already in operation, and we selected 6 vendors across the state. 2 of those vendors were local vendors, Texoma Paratransit System up in North Texas and Project Amistad in El Paso were chosen as local providers to continue to do that. Most of these, or all these transits have, or all these companies have contracted with local transits to continue to serve individuals in these service areas. So we believe that we have a new capitated system to provide medical transportation that will give us extraordinary efficiencies in how we deliver those services. As you remember, Rider 51 during the last legislative session had some cost savings associated with the medical transportation. I'm pleased to report, and I think we've reported in the past, that we've exceeded those targets for medical transportation, and we believe this managed transportation organization model will allow us to continue to exceed those cost savings estimates that you'd received earlier.
The data analysis unit is what I was just speaking of a few moments ago. We have been standing this group up over the last few months. Very appreciative of the legislature of establishing this unit. It's really helping round out our strategies for better management of our contracts. We are in the process now of calculating a number of measures that we will use on a regular basis to measure how well we're doing. A couple of examples of those are, for instance, we'll be looking at by HMO, how many providers does the HMO say are in their networks versus how many are actually billing, so we can see if there's potential issues there. Same thing for how many members are enrolled versus how many are receiving services, potential to be able to look at if there's access to care issues, looking at utilization trends. For instance, if a particular HMO's ER usage is going down, that will give us an indication there might be something good going on there that we want to investigate and perhaps share as a best practice with other HMOs. Just some ideas of some of the things that we're going to be doing, as well as creating some dashboards and early alerts to give us a sense of whether something really might be a problem, so that our health plan managers can go in there and either talk with the HMOs, do an on-site review, that kind of thing.
Mr. Chairman.
Senator Nelson.
Thank you, Mr. Chairman. When will the data analysis unit be fully operational?
All but 2 of the staff have been hired. They are in the process now of putting that data book together, and they have already been doing, at the request of the health plan managers, they've started doing some digging in the data for them. So I would say that efforts are already underway, and we will have that fully operational this fall.
Okay, great. Thank you.
Continue.
On slide 8, provider marketing was addressed in Senate Bill 8. Doug and his staff had brought to the attention of the legislature some questionable practices by providers, and so we have been working with Doug's staff to put in place some guidelines that are very specific to providers, so that they really have a good idea of what is allowable and what is not allowable. So for instance, a billboard is allowable, a mass mailing to everybody in a zip code is allowable, but but providers who are doing targeted outreach to specific Medicaid members, who are, providing big giveaway prizes, that kind of thing, those things are unallowable. And those guidelines are on the web and provided in an easy to understand format. If a provider does have a question, they can submit their ideas to us, and we can give them a stamp of approval or let them know that what they're planning to do is not allowable. Page 9, another contract management strategy that the legislature gave us this past session is a utilization management and review unit. Again, this is going to be focused on contract management for us to be able to see by HMO what are their practices in determining if somebody needs a long-term service and support, or and when are they authorizing the services? Are they authorizing them as quickly as they're supposed to be? There's a very big difference in the payment for somebody in Star Plus who gets just acute care services such as hospital and physician, and those that also get long-term services and support. So we want to make sure there's no gaming going on by the HMOs, and that if they are identifying an individual as needing long-term care, that they are actually getting those services and they're getting them timely. And so we've been standing up this unit as well over the last few months, and we'll be doing statistically valid randomized sampling by HMO, going on site, visiting with them, providing technical assistance to make sure that they are providing good quality services.
Continue.
Good morning. My name's Joe Schmider. I'm the Texas State EMS Director, new to Texas for 1 year, former 10 years of State EMS Director for the Commonwealth of Pennsylvania. I wasn't driven out of the state. Both of my children ended up graduating from college and ended up working in Austin. So I did not dig out 78 inches of snow this year, and I'm really enjoying my time here. It's been my pleasure and honor to speak before this committee this afternoon and to work through Senate Bill 8, which is getting national recognition from other states on trying to deal with the fraud in EMS. So kudos to the Senate, to committee, and to Senator Nelson. As you look at the one slide that we have here, the moratorium will end as of August 31st of this year. And over the course of the year, we've issued about 12 licenses to organizations that have met the requirements for the exception, government bodies in a rural area. But other than that, no license have been given since the moratorium went into place. The application has been updated to reflect all the changes due to Senate Bill 8 and House Bill 3556. That application is now online, and it really walks the EMS provider right through the process and attesting to what they are supposed to meet as the requirements under Senate Bill 8 3556. All the new rules are in place and adopted as of August 10th of this year, so that's in place. Met with the League of Cities and the Texas Association of Counties to offer assistance with them if there was any issues on, as you know, in this bill, there's a requirement for the municipality to give a letter over for the first 2 years to start up a company, an EMS provider to start up an organization within that municipality. We also provided them a NHTSA document, the National Association of State or National Association of Traffic Highway Administration. A document they put together on how you can assess your local needs for EMS, and it's a kind of walkthrough document, a chart you fill out. So those relationships have been made, and without any real issues. I mean, we'll really see what happens after September 1st, but that has been done and taken care of. The medical directors, everybody has to have a medical director. All the advanced units already had medical directors. The BLS are now required to have it. That's been in place and moving along without any real problem. We will be offering, starting on September 1st, an online initial education national project program with Chapter 8 being just on Texas. And a doc can do that online at their own time, and they'll get a certificate at the end of that program. So just to kind of level the field and give them the basic education on EMS from a Texas and as from a national standpoint.
Mr. Schmier, do we have?
Sure.
Do we have a number of individuals, entities applying for new licenses as the moratorium is expiring here in a few weeks? Do we already have applications in?
We have 0 in
Zero
as of
in.
yesterday afternoon, close of business.
That surprises me.
Yes. The
Senator
adminis-
Zaffarini, you recognize?
The administrator record course is going to be offered at the conference this year in September, or I'm sorry, in November. So it's a 2-day program on teaching administrations. I'm sorry, Senator, you had a question?
Yes, how has thank you, Mr. Chairman. How has the one-year moratorium affected the rates of Medicaid fraud? That was the intent of establishing the moratorium, so what has been the outcome?
So what the moratorium did was kind of gave us a break to update the rules and put in some checks and balances to ensure that the services that are coming to Texas have the skills, the knowledge to produce a good operating company. So under the rules, what we were able to do is there are 5 requirements for an applicant to attest that they have understand and read the rules and laws of EMS in Texas, that they show proof of 1-year experience or taken a national recognized course on EMS dispatch, EMS billing, medical accountability, and quality improvement. So what this does is, as the applicants are coming forward, they actually understand what EMS is. And I think you'll get a better application. You'll get a better educated owner of a company as they come forward to apply for EMS license here in Texas.
Well, as the state moratorium expires and the federal moratorium in Houston continues, what will be the impact on the other parts of the state, those outside of Houston?
Both of them expire at the same time.
They do expire at the same time?
Yes. So, we don't anticipate a major influx of new applications because we're going to have better quality of applications coming in, more professional applications coming in, not just people trying to start a company because they've been sold a bill of goods that this is an easy way of making money. Because they're going to have to be able to document either through past experience or education that they understand what EMS is. And you may have heard me tell the story about 3 weeks before the moratorium went into effect. A gentleman called me in the office and said, I would like to start an ambulance company, but I have one question. Could you explain to me what BLS stands for? And that's basic life service. And if you're in the EMS business, that's kind of like you don't know which side of the Band-Aid's sticky. So it just doesn't, that is basic stuff. I think the steps that we've taken will prevent that from happening. We will have educated people coming to Texas to start companies.
And you're confident that we have all the safeguards in place now to ensure that all the providers are legitimate businesses, especially all new providers?
I do. I think we have higher standards than any other state in the nation, and other states are looking at us as a model to represent. So I think we've done everything we can. We might have to come back and tweak stuff in the future, but I think all the standards are there to prevent what was going on in the past.
Thank you. If I could ask a question to the OIG, Mr. Wilson. There's been some concern that South Texas has been targeted for fraud investigation. Is there any merit to that concern?
Senator Zaffarini, no, not to my knowledge at all. I sort of like to say we don't target any providers. Perhaps their behavior does, but not us. I mean, so we're following leads and complaints that we receive and/or letting the data analytics system point us to anomalies in the data and suggesting what we should look at and why we should look at it. So,
has there been any difference in treatment of those who were investigated before June 1st and those who are investigated after June 1st? For example, decisions about lifting their payment holds.
I'm not exactly sure I follow the question, Senator, but no, not to my knowledge. I mean, our processes are pretty much set in place, and our staff should be following.
There wasn't a process that resulted in lifting the payment holds before June 1st and providing feedback on a faster basis than after June 1st?
If you're referring to informal review meetings that we have, we still lift payment holds. That's an ongoing. It's not like we had a window of time where we said we'll lift a hold in our informal review meeting and then we decided not to. So any provider that has an RRM and presents information to us that suggests the hold should be discontinued, it will be discontinued.
Okay, thank you. Thank you,
Yes,
Mr.
ma'am.
Chairman.
Thank you. Mr. Schmider, there was an EMS report in reference to diminishing waste, fraud, and abuse, and then also some sunset recommendations that were adopted. Are we already implementing the sunset recommendations? Are we waiting for the bill to pass, or they coincide fairly?
Well, it's a little bit of both. Some things will require some additional legislation, but the majority of it we're doing now.
You're keenly aware of those recommendations?
Yes, I am, sir. And actually, I have them here.
Very well. Continue. Any other questions, members? Senator Nelson?
I need longer arms. Mr. Wilson, if state and federal inspector generals know that we have fraud in the system, why is it so difficult to successfully prosecute these cases?
Senator Nelson, I think that's a very difficult question to answer. I mean, I think all states, we just had a National Association meeting for Medicaid Program Integrity last week in San Antonio, and I saw a lot of my counterparts from 42 states were represented, and so we had conversations around our cases moving, and as you know, on the criminal side, those cases can take 2, 3, or 4 years before it actually gets to an actual trial. And I'm often asked about if they've done something wrong, why don't you prosecute them?
Yeah.
That's not what we do in the Office of Inspector General. I'm on the administrative side. Civil Medicaid fraud and the Medicaid Fraud Control Unit deals with criminal and civil Medicaid fraud. I'm required to refer those cases to them.
What's the holdup there? Why is it taking so long?
I mean, they're working cases. I know that. I get notices. I got noticed about a week or two ago from Rick Copeland, the director there, of a successful prosecution of a case. I was there for 6 years myself, but on average, those cases, as I said, can take 2, 3 to 4 years before you actually get in the courtroom. Because as you know, Office of Inspector General is presenting cases, Attorney General, presenting cases to district attorneys and U.S. attorneys and getting into their case flow to prosecute Medicaid fraud cases. That can take some time. When I was there, these cases could take up to 3 to 4 days to a couple of weeks, which ties up a courtroom for days, and so it can take a while for these cases to move through that system, and probably the Attorney General's office, Medicaid Fraud Control Unit, somebody would be better to answer this particular question than me.
I'll ask them. Thank you.
Yes, ma'am.
Along those same lines, Mr. Wilson, how many new individuals were added to your division, FTEs, with Civil 8?
Approved FTEs was 120, not SB 8. You're talking about?
sorry.
I'm sorry.
With the latest,
During the last session,
Last session,
127 total.
127. And
Yes, sir.
total amount of, how many people are in your division currently?
774.
Right.
They're not our field, of course, but some
Right.
FTEs.
And how many investigators do you have out of those 774?
Rough estimate, 170, a little less than 200.
The rest are administrative support staff? And
No, I've got
analysts,
auditors, nurses,
Right.
Analysts, attorneys.
Actuaries?
Yeah. It's a myriad of different professions.
Right.
Yes.
Okay. Thank you.
Yes.
Any other questions, senators? Thank you, panel. I appreciate it, Commissioner. Thank you.